My name's Colleen. I'm 40 years old, and I developed RSD at the age of 10 after I had a hairline fracture in my foot. I spent about 15 years being misdiagnosed, traveling down the MS route until I finally, through my profession, I had multiple neurosurgeons looking at me all the time going, this is what I think, this is what I think, this is what I think, and finally I had one look at my leg and go, no, that's this disease called reflex sympathetic dystrophy. So I was lucky enough to find, he referred me to a doctor in Las Vegas, and it was almost immediately when he noticed the discoloration in my foot, the burning pain that I had. He did an initial image with infrared, and my toes were black, the bottom of my foot was black. The disease progressed in my 20s after a series. I was a marathon runner for a long time, and the disease progressed along my left side and into my left hand, and then into my right hand. So at the age of 36, I was forced to retire, and then the disease moved into my stomach. I developed a gastroparesis. I had a gastric stimulator placed 2016 to control my vomiting, and unfortunately does nothing to control the nerve pain. Ketamine has been really the only thing that stops that burning, horrible pain that I get in my stomach. I've had two neurectomies done, one in my lateral femoral nerve and then one in my dorsal pedal nerve, to try to be able to tolerate even wind blowing against. That was not helpful. I had a dorsal ganglion root stimulator placed once I ended up in the wheelchair in 2013 to try to get me walking. Still was not walking. And then by chance, after I had this stimulator placed in 2016, they gave me ketamine in the ER to try to get me to stop crying, and it was immediate. I could move my foot. I had all this wonderful, results. So I spoke to my doctor, and he referred me to his sister practice in Arizona, and I started a 5-day infusion August of last year. My pain was at a 10. After the first day, it went down to about an 8, and by the end of the week, I was at a 6, and I was walking. I lost 22 pounds. I could eat again. I was able to drop my morphine by 75% and my oxy by 75% also. Lasted about 2.5 months, and unfortunately I had to pay out of pocket, so I had to wait till I could get the funds up again. Had another infusion done in April, and that time we were able to get my pain down to a 4. Lasted about 2.5 months again. It did throw my gastroparesis and stomach pain into a type of remission, and I was able to gain appropriate muscle mass again and weight, and I was out of the wheelchair. So in the last, I would say 2 months, ended up back in the wheelchair, vomiting anywhere from 50 to 100 times a day. It's painful to drink water. Can't tolerate a shoe on my foot or anything touching it again. I have severe skin sensitivity everywhere, so I'm looking forward to getting this going again and walking. Yeah, I can do this. I can do this. As you'll notice, I have this really large abnormal swelling. This usually goes down after about 2 days of infusion.
Other than the leg going up and down, you can do basically, so that pretend you're laying on your side, you can also do front and back.
Okay.
Trying to keep that foot hip level.
Okay.
You can do knees to in and out, chest. So just basically active movement. What I was going to say is, if it does get to the point where you feel like your pain is decreased and you have the ability to tolerate pressure on it,
Okay.
then you may consider, hey, coming back over here and there's some stuff we can do.
I did think of something, because when I noticed the last time is when I am able to put my feet down, I still am walking on the side because my brain thinks that that's what I need to do. So
Right.
I think my experience with ketamine, I wish I would have been able to start this about 5-10 years ago. It's not a painful process. Most patients worry about the hallucinations. Medications that they give really help, and it's actually kind of like a peaceful process. I use music. I have a deep meditation music that I listen to that helps activate certain brain waves, and I use eye covers so that I'm completely surrounded in this little space, so I'm allowing my receptors to open up and the ketamine to work properly. And when I do that, I notice after the first infusion that I'm able to move my foot, I'm able to tolerate it being touched, my stomach pain is better, I can eat a meal again. So if you're questioning if this is right to you, my question for you is, what do you have to lose? It's a non-invasive procedure. If it doesn't work, you'll know almost immediately if it doesn't work. And so for me, it was worth a shot instead of going and getting another surgery to clip another nerve that may or may not make me worse.